All right. Good morning, everyone. My name is Carly Lighthizer, and I'm the Extension Program Specialist at the UF IFAS Center for Public Issues Education in Agriculture and Natural Resources, also known as the PI Center. As part of my role, I'm a member of the Outreach Corps for the Southeastern Coastal Center for Agricultural Health and Safety, and I'm pleased to host today's webinar. Thank you all for joining. Today's webinar is Preparing Farmworker Communities for Hurricane Season, featuring Dr. Marysel Pagán Santana. Dr. Pagán serves as Director of Environmental and Occupational Health of the Migrant Clinicians Network in Puerto Rico, where she leads and coordinates projects related to occupational health, disaster preparedness, and emergency response. Today's webinar will begin with Dr. Pagán's presentation, with questions being welcomed throughout the session. Throughout the presentation, please leave all comments or questions in that Q&A feature at the bottom, and I'll moderate as time allows. When prompted, feel free to reply directly to Dr. Pagán through the chat feature. If you happen to miss anything, the webinar will be recorded and shared out afterwards. Before beginning, I wanted to preface the webinar with a little bit of information about the Southeastern Coastal Center in case you haven't joined us before. So SCCAHS, as our acronym is part of the Centers for Disease Control and Prevention, CDC, National Institute for Occupational Safety and Health, or NIOSH, the Ag Health and Safety Initiative. Through this initiative, SCCAHS explores and addresses the occupational safety and health needs of people working in agricultural, fisheries, and forestries in Alabama, Florida, Georgia, Mississippi, North Carolina, South Carolina, the U.S. Virgin Islands, and Puerto Rico. And with that, I'm going to hand things over to our presenter and we can get this webinar started.
Slide share. So, welcome everyone. My name is Dr. Marysel Pagán Santana. I'm the Director of Environmental Occupational Health for the Migrant Clinicians Network. Located in San Juan, Puerto Rico, but organizations and nationwide organization with several locations throughout the continental US as well. I've been working in emergency management and preparedness since 2014, and since 2018, I've been working specifically with farmworker communities and the role of several community-based organizations and particularly community health centers in supporting the resiliency and emergency preparedness and management for these communities. So today's presentation, we're going to talk a little bit about that preparedness, but also the role of different community actors that can improve disaster preparedness work and systems and how to integrate them in your either your workplace safety protocols, or if you're part of those community-based organizations, how to integrate yourself in some of the emergency management systems of those centers that are located in various areas, including Puerto Rico and the islands. We have three objectives for today, but particularly we're going to focus on understanding the factors for vulnerability emergencies, particularly for farmworker communities, what the impact of that hurricanes, the latest one, let's say about talking about from Hurricane Irma, Maria, and on that in the different farmworker communities and their employers, and also some of the actions that we can implement to explore, adapt, and do some prevention and mitigation actions. The idea for this is that we look at preparedness as a bigger system than just individual preparedness, and we look at some of the actors within our communities that can help out strengthen our systems to avoid health impacts in this community. So a Migrant Clinicians Network, we use this framework when we are assessing weather-related emergencies, and particularly those that we're looking at as part of the climate change results. So if we look into your the left column, you'll see weather emergencies are environmental stressors, also called in that way. Extreme heat, flood, droughts, hurricane storms, earthquake, and so forth as examples. And then we want to focus on systems, public policy and regulation as where you can intersect. We know that we have ways and we have looked at diminishing the impact of climate change or what we have done to create climate change as humans to mitigate some of those. But right now, one of the works that we are doing as Migrant Clinicians Network and some of their partners are focusing on systems, public policy and regulations for mitigation, given that a lot of the results from climate change are already happening. And there's not a project that will stop or decrease the intensity. So we'd like to see a lot of what we're looking at, law and regulations, for example, health and safety at work and the heat-related regulations that we have seen in different states, and hopefully eventually a federal standard for the regulations, but also comprehensive emergency management systems and processes, access to healthcare, and then sustainability and the rest of the infrastructure. So these are the items that we look at when we want to avoid the outcomes of not having that. So when we look at outcomes, when we don't have appropriate systems for the policy and regulation, we will have displacement and movement of individuals, impacting mental health, illness and injuries, and sadly also deaths. 2024 report, so you have an idea of what that means economically to the US. We have around we have billions of dollars of loss related to weather disasters that coming from hurricane in the southeast areas, including the Caribbean, but also unexpected flooding, tornadoes, wildfires, and long-term drought of heat waves. So when we talk about climate change, we also know that employers in agricultural communities are suffering from loss, and that will eventually have repercussions of the job security and other factors that may alter the livelihood of agricultural communities, like access to care, access to a safe housing, or even the probability of moving to if you're a migrant and seasonal farm worker, that actually getting to stay during the season and having enough to go back. We know that, for example, for this year, some of the loss of crops in some of the northeastern area of United States that has the diminution or decrease of H2 workers arrival because there's not a lot of job for them because of crop loss. So there's a lot of consequences coming just not only for the employer but also for the job security of those employees. Challenges related to these environmental stressors into the agricultural industry, crop damage, soil displacement, infrastructure, supply chain disruption, like I said, workforce being impacted, but also we'll see that production process have changed depending on how the crops are behaving. So if we have that and we have a supply interruption again, a lot of the components that can make somebody more vulnerable are starting to get damaged or interrupted, not only because of the industry and the ability of the employer itself to maintain that employment for that person, but also some of the payment and benefits that may be related to that workforce. If we go over recent events in US in the territories, Hurricane Maria represented 80% of crop loss in Puerto Rico. And this is something that represents a lot of the areas that are mostly comprised or represent areas that are related to small farms and family farms. So 69 of these farmers, and this is in Puerto Rico particularly, experience at least 1 month of food insecurity after Hurricane Maria. So it's not just the workforce like we know it in terms of agricultural workers and migrant workers, but also the farmers that are not able to sustain their families and themselves and have food insecurity. So our expectation is that 69% was on farmers, that for farm workers, the number was higher because they not only had not access to their food, but also not decreased access to work during those 3 months. When we look at Hurricane Ian in Maria, that caused a huge drop in the crop production of citrus production in Florida. So again, when we have that drop, it's not only the initial response to the disaster and the implications that we can see, like flooding and always flooding, we're not able to work, but also the long-term recovery of these processes. If we saw Hurricane Irma cause a dip in the citrus production, the process started to recover in the crops, and then Hurricane Ian again as a new disruption that has been able to recover us. We hopeful. So again, if we look at 2012, at the beginning of that chart to what we have now, we keep losing some of those volumes, which translate to not only the availability of the product itself and loss in the farmer area and basically like economic loss, but also the decrease of job opportunities for some of the farm workers, which means that income loss and job security gets affected. Urea in North Carolina got hit by the winds, causing also a loss on timber growers and some of the other agribusinesses, including Florida and around $10 billion was reported in losses. Again, because of the nature of this industry, the vulnerability for environmental stressors and disasters is very high. And the workforce of this particular industry then is highly vulnerable to those disasters. Who can be impacted, or who are we looking at? People who work outside, including agricultural communities, which we're focusing on today, but also take in consideration people who work in construction or recovery processes. People with low income, chronic illness, people who are pregnant, elderly children, or mobile. Mobile individuals will have different categories, which you can call on. There's people who move to a place because they were displaced for another type of disaster, can be a political situation, or can be displaced because of a environmental disaster in their place of origin, and arrive to a place that is also highly vulnerable. We see it a lot with people who live within the states. Let's say people who moved from Louisiana after Katrina to Texas and then got impacted by Harvey. So there are people who are displaced by environmental disasters who are they're more vulnerable to other disasters when they're moved. There's people who are moving because they are part of the resilience workforce, so they're gonna move to help out on the recovery. And there's people who are gonna move because of the job preparedness. And those are all severely impacted and vulnerable. And farm workers may fall in these three categories because of their type of work that they do, and particularly in the resilience case, because usually they will switch from working in the farms to working construction when there's a low season or they're on break from one of the seasons. So then we switch to construction, and then we continue to be vulnerable as well in that area. When we look at the farm worker communities and their vulnerabilities and health profiles, we see that they are also at highest chance that they may have any chronic conditions, and that the way that they, because of the lack of access to some of the health systems, they might be affected, especially when something's going on related to disasters or pandemic events. Conditions that can be really affected and highlighted when the access of care and even access to medication is limited due to a weather-related disaster, diabetes, PVC, dementia, COPD, asthma, mental health disorders. A lot of those need continuity of care, and some of the displacements caused with weather-related disasters will cause the person to lose that continuity of care, and as a consequence will increase or damage furthermore their health. What happened with specifically migrant and seasonal agricultural workers? They usually tend to first face more challenges related to weather emergencies, including flooding. Because they already are new to space, they might not know the specific of the areas that they are working on. Think about you moving to a place and not knowing that is subject or vulnerable to flooding. And you think something is coming, you don't know about the hurricane season, you're new to that type of situation. Florida and Puerto Rico, we know this, it's kind of like almost organic the way that we change our mindset within the hurricane season, but people who are not used to living the Caribbean or the East Coast may not know exactly what it means to refer to the season. So think about people who are arriving for the season and what information they might need to know. Evacuation procedures or even flooding zones and understanding that maybe the housing that they have right now is in a flooding zone and you may need to know when you need to evacuate and where to evacuate, where are the shelters. Sometimes they may have restrictions in terms of the language that they're receiving the information. A lot of physical labor. We have seen pictures like this one that you're seeing, where workers continue to work even under weather advisory processes. Here you had like a record rainfall going on in California, like winds that keep working, trying to clean up the crops so the crops will not get lost, like keep the water from damaging the crops. We have seen similar photos for wildfires. So these type of workers may be at a higher level of risk. We know some of the experiences in Puerto Rico, for example, with HUA workers were located in the workers camp. And even after work, there was an emergency of flooding going on, and they didn't know how to evacuate and where to go. So they were not advised about living in a flooded zone or a prone to flooded zone and how to evacuate. So they had to be rescued. And this is the kind of information that you, as an individual who just moved to a place or temporarily going to a place, may not know. And also, you may not know other physical conditions that person may have that require some activity of care. Again, exposure to heat, pesticide exposure, dehydration, and other problems might increase the risk of them when there's some of the systems get interrupted due to weather related events. Like I said, there are additional challenges like languages, culture and traditions, low wages. We are saying that some of that is getting changed in policy, so that may even increase their vulnerability because wages are going to get lower for some of the seasonal workers. Thus displacement, and again, limited access to healthcare and resources. Understanding these limitations will help you figure out what you need to put in place to help them be healthy. And if you're an employer, your motivation to make it so they continue to be healthy during a weather-related event is that you get healthy workforce when you need to come back and recover from that event. So you need a healthy workforce to be able to recover your crops. You need healthy workforce to be able to respond to the emergency in whatever manner you need to respond. So understanding the system that will help them be healthy within these processes will help you at the end to avoid those financial losses that you were discussing at the beginning. Specifically coming from the health and safety point of view for migrant and seasonal workforce, and that's also applicable to agricultural communities overall. Chemical exposure due to spills that occur during the flooding. We have seen several cases where hurricanes will impact the storage zone of pesticides, and then will get all spilled out throughout the place, and somebody has to clean up that. So that exposure to spills, injuries, and illness related to trying to either prepare for the event or recover, like debris movement, or even setting up areas for protecting the warehouses or areas like getting on the roof to protect roofings. So for the housing camp, depending on what they're doing. Another piece that we're gonna discuss a little bit today is the heat after the disaster. So there's a lot of information that just after a hurricane or storm passes, the amount of heat and humidity left over will put you at risk of heat, stroke and heat illness and injuries. So making sure that we think about water, shade, and rest during those events and not relying on because it's raining, that is gonna be an easy area to work in. Falls and injuries during hazard mitigation event. Think about the mental health and well-being of the workforce also while preparing to that. Specifically, if we are working with workers who are already experiencing any type of disaster. So people will have PTSD or be reliving some of the traumatic events from previous disasters. And when they hear something is coming, like a hurricane, they might get anxious, and the way that they work might be interrupted, like a lack of coordination. People are not as attentive to what they're doing because they're anxious and worried about their safety during that event that is coming. So a lot of falls and injuries, they're trying to work in fast so they can go back to their families or do other tasks related to their safety, and that may increase falls and injuries during that mitigation events. Polluted water exposure also will create some bacterial infections, so making sure that we are working with them and providing the correct PPE for them, the equipment, and then also understanding those who might have chronic disease that may need to not show up for work and then go to a healthcare. Going back to the heat pumps that are created to or after. Carly, I'm getting a message that my connection is supposed to be stable. Did I get interrupted by any of the conversation?
Yeah, you are cutting in a little bit in and out.
Just let me know if I put out for a second and I'll switch back on. So there's a lot of heat that comes out of the hurricane passing by. And also we know that we might not have energy grid available for resting. Even if you're working throughout the day, it's not only taking into consideration that this might be for you as well. Not only people who are working outside, but then the lack of spaces to be able to rest even during the night because there's no energy grid. You may be looking for water and even food during that first 48 to 5 days of recovery. So people are not able to recover from heat exposure and are more subject to being on heat stress or heat strokes. And just remember that for agriculture workers and construction workers, the risk of death related to heat-related illness is 35 times higher for agriculture workers and 13 times higher for construction workers. So if we're looking at that in normal situations, think about when we are recovering from a hurricane and trying to work, but also attending to the implications that the event had in your personal life. When we talk about political agents, check about mosquitoes that may be reproducing because of the waters being stocked in different places. Mold and mildew will impact all the areas that get flooded, especially housing and even shelters in some cases. So knowing that they might be even the storage area for the farm itself may be impacted. So knowing that occurring, applying the appropriate protocols to remove the mold and mildew and make sure that people who enter to do that in the world are knowledgeable of what they're doing and have the appropriate protection to do that. And then also, again, the bacteria in contaminated water that may cause gastrointestinal diseases or even the clostridosis in place of contact with polluted water or polluted areas caused by the deposit of mouse urine. We work a lot with community health centers and look at it. We present a lot of what it does, like urine system, or whether we event will do to a health center. The reason why we're focusing on health centers is because a lot of these federal health centers will serve the population that we're talking about, agricultural communities that served by these centers. And if you're an employer or if you are a community-based organization, I urge you to start connecting with that community health center because likely those are the people who are gonna be helping out the workforce to recover and get their health up to date after the disaster. In addition, a lot that we work on is that these disasters may interrupt the operational clinical programming and staff members of those community health centers. So the better prepared and integrated with different community members that the health center is, the less impact you'll see in the center, more access to health will be for the service area, and then we can just try to respond to really specific issues or areas that are more impacted than others. But if we really don't work with them and not integrate those systems into their systems, we lose a really key member of our response and preparedness management system. So what can we do? MCN works a lot with community-based organizations and health centers to apply a community mobilization framework to protect the health of communities that are developed, particularly agricultural communities. We use the community mobilization framework because we understand that creating processes from within the community for the community by the community are more sustainable, adequate, and probably more culturally appropriate. That's something that just comes in from another place because we implemented let's say trying to do a one size fits all is not gonna work for these economies. And the better you integrate the community and even the same workforce that you're trying to protect, the better the plan gets sustained. Again, this is for health centers. If you're part of a health center or a health department, this might be useful for you, but also if you're a community-based organization or even has any type of initiative within your academia, think about infrastructure and making sure that what you have as a system center has a way to be sustainable. That means understanding that you have a backup power, communication, and whatever support that you're bringing to the community needs to be sustainable. So this means that it cannot disappear because there's a weather disaster. We need to make sure that you are able to also overcome the same disaster so you can be able to help. Creating relationships with communities and partnerships is what we've been talking about. There's a lot of ways to create partnerships with different community-based organizations, health centers, academia, government, to make sure that we have the information needed to be able to respond. Training and support, not only for the clinicians, but also for the workers and people who are going to be enlisted as volunteers to make sure that they understand what they need to do, how to protect themselves, and then how to work within the system to make sure that we're responding adequately. And then mental health and well-being support to the staff. If you have a community-based organization that is working disaster response, whether that's a community health center or other type of organization, or even if you are conducting research, let's say that your center or your department had was awarded a rapid response grant for that specific disaster and you're out in the field, remember to establish a wellness program within your staff. And this is because even if you're doing research, you're absorbing a lot of the trauma that you're seeing outside. You're having interviews with people who's affected. You are either treating or helping out people who has been affected. And a lot of the information, emotions, and knowledge that comes through can be hurtful and painful for different persons. To making sure that we're keeping our staff also in shape and giving the support needed so that the well-being of the staff that is helping out, whether that's a volunteer or researcher or somebody who's actually working on disaster response, is able to continue with the program. And even if they need to be removed, understanding where that removal phase is going to be out so we can prevent burnout. So why are we engaging communities? I talk about this working around, but also there's history about how the natural disasters that we have experiences and the response may not be appropriate. We saw there's a lot of recommendations coming out of Maria, Irma, Hurricane Ian, Hurricane Michael, even from Katrina. If you have seen some of the recent documentaries that went out, there's a lot of highlights of what went wrong in responses. And a lot of that had to do with really not integrating appropriately communities into emergency management. For National Emergency Management Framework, established that the best way to implement that framework is using a bottom-up approach, which means that we want communities to be able to respond to emergencies and disasters. So they can help out the government and other third sector like nonprofits and disaster response organizations to work appropriately because they're not going to have the information required to display their help. So there's a lot of need to engage communities to have them prepared, but also to understand who to call, what the limitations are, and then what the flow chart is for those communications. And if we do not integrate communities since the beginning, there's a higher chance that the deployment of governmental in that state or federal is not going to work as planned. And also, if you're a health center or a department, you have compliance and management. Compliance and management start in terms of disaster preparedness and response as part of your actual requirements of your job. So it's important that we make sure that we integrate communities into that emergency management process so we're all in the same page. So how do we apply that community organization model to work with communities into talking with them about disasters? And we have done this with several communities, particularly with communities in Farmworker worker communities and overall with rural communities in Puerto Rico and the Islands as well, with San Thomas and San Victoria. We work with them looking at previous experiences. Again, there's a lot of mental health needs to work through this because there's a lot of trauma related to it. Still a lot of recovery processes going on and challenges. So make sure that we do have that mental health support to your staff that is working on this, but challenges and opportunities. And if you don't have enough information, you can do a lot of some research about what happened before, like what areas got flooded, what are the new flooding zones, and what are the new recommendations for your areas. Identifying needs and resources, particularly the resources, because a lot of the resources that are available in communities might be unseen. For example, a lot of our communities do not consider commercial areas as a resource. And they were very surprised where their local supermarket agreed to separate a space for medicine that needed to be refrigerated to it. So just to give you an idea that some of the needs that you may have in the community may be addressed by your own community if you're looking and mapping your resources. And then there's a piece on building capacity, whether that's emergency management training or making sure there's a search team in your area getting trained, or even CPR training to get them to be able to respond in communication and coordination with the authorities, whether that's the health department or the clinical sector. And we look at those three components before doing an after disaster. It takes some time in discussion, but you can create a really good framework of how the community is going to move around. It's something like a hurricane, like Michael or Ian or Maria happens again. The good thing about working these community mobilization frameworks with communities is that you not only get a good integration in the preparedness area of the community, but you also see some stronger community members. You see leaders surface, even if they're not self-identified as leaders. There's a lot of capacity building and it was self-efficacy. So communities will see themselves more empowered when they're working their own response rather than being told what to do. And they also will bring you, which is a kind of a funny situation, will bring you more work because they'll start identifying some of the other needs related to environmental challenges, and they will be willing to work in them and with them so they can get solved. We had a community that started working on landslides and how to communicate and also survive because it's a community that gets isolated and it rains due to landslides in the area. And we ended up talking about soil removal, pesticide applications near the community and how to work with farmers to decrease the exposure that they have in the house. So again, there is the preparedness piece of it, but also the opening of that relationship with that community. What is our role as clinicians and public health professionals? You're a trusted messenger. People really trust people who are working in health centers, people who are public health professionals. They trust the information that we're giving to them. And I know it sounds weird because recently we have seen a lot of distrust in some of the public health agencies, but when you are working with specific community and building that relationship based on this emergency preparedness framework, you become a trusted messenger. You are sharing with them information, and because of that openness that you create with them, you become that trusted messenger for all their health-related stuff. Understanding the healthcare options and connections, you're bringing information, useful information, making sure that you're not just taking information from them when you're creating your plan. If they're an employer, you're understanding the health needs of your workers, but not using that information to not get opportunities. So making sure that you're using this to create trust and not to break that. They understand that they're supporting their good practices and that it's gonna be, because of that capacity building that you're doing, that's gonna be helpful at the end. And then also, it is our role to adapt that information to the needs of the community, which means that we need to see translation and interpretation if needed, and then to make sure that the literacy level of what we're sharing is useful and resourceful for the community that we're working with. And just a couple of tips or topics to talk about within your community that may decrease their exposure during these events. Proper chemical storage, make sure that if you're the employer, that the workers, that you have the proper chemical storage for them and that they're following your SOPs to secure additives, have that chemical inventory and that the personal protective equipment available, how to prevent risk at works, and emergency plans, including care management and mental health. If you are in a community health center, talk to the patient about what they're doing for work and how they can prevent and work through these disasters. We get them, we see them for routine work or even medical certificates for being able to work. So if you're getting that because of your job, that's about their job, the type of work that they're doing, and make sure that they know they need to have personal protective equipment if they're dealing with chemicals, and then to make sure that they have emergency suit in shape, right, and available for them. And lastly, I'm sharing a couple of resources that MCN has available on their webpage. We're going to share the slides so you're able to click on the links. MCN, this guide is created for clinicians and community health workers. So if you're community health workers, this might be useful for you, and how to address related illness in farm worker communities. And this is also getting reviewed. So if you sign up for our webpage, you're probably gonna get a notification when that the 2026 or 2027 version is gonna be available. This is available in English and Spanish, and it also has resources for workers. We also have comic books and facilitated resources regarding investigative health that go from wildfire, discuss the air quality index, and talk about respiratory protection for farm workers. That's also available in English and Spanish. And this one is getting put in a video movie as well, so you can share it with different sources. And it's my understanding that it's getting recorded into audio, so it's more accessible, both English and Spanish. If you're looking to create some kind of plan with your community and you're not sure where to begin, we also have an emergency management hub that goes through different processes, including community leadership and community outreach. And there's some introduction to what it means climate change and what are the events for these agricultural communities. It has a tons of resources linked to it, so it's a really long and it's a really long curriculum, but it's divided in models for your benefit, so you can go and pick where you want to start off or what you want to look at. And it basically has curated a lot of MCM resources, but also resources from other organizations, and just created a one-stop shop for people to access those resources. That is available in English and Spanish, and currently being translated to Creole. So that's going to be probably going to be at the beginning of 2027 available for that language as well. Sharing my contact information in case anybody wants to reach out for technical assistance or additional training, and just know that MCM is now in Substack in case you want to subscribe for our page, and making sure that you're connecting with us through a webpage and newsletter. Thank you.
Great. Thank you so much, Marysel, for your wonderful presentation. So I open up the Q&A now if anyone has any questions. In the meantime, I dropped a few things in the chat. In addition to the resources provided in this presentation, there are a couple other updates from the center I wanted to share. So our next Ag Safety Center webinar will be on Thursday, August 6th, and it will be modeling New World screwworm infestation in Florida. There is a link there if you would like to join or register ahead of time. And then also speaking on the topic of tropical storm readiness, one of our partner programs is hosting a webinar also in August with the National Weather Service. So if you're interested in tropical season readiness and would like to know more about interpreting forecasts and what that means for your lives, that Zoom registration link is there as well. So you'll be getting lots of resources after this webinar. In addition, you'll be receiving a follow-up email tomorrow with the recording, the link to resources, and then also there's an evaluation survey. We would really appreciate it if you could fill out this evaluation survey so that we can continue providing timely and relevant learning opportunities. Thank you again, Marysel, for your wonderful presentation. And it looks like we haven't received any questions yet, but we'll stay on for a little bit longer in case anyone has any closing comments.
I'm gonna take advantage of announcements and just share that we are currently putting on research project on cancer prevention and disasters. So you get subscribe to the newsletter, you get a chance to subscribe to our learning collaborative that is gonna happen in October related to how to continue patient navigation of cancer patients to the disasters and for the related events.
And Marysel, if you want to share that link with me, I can put it in the follow-up email as well.
Yeah, I'll share it with you. I don't have it on hand, but I'll share.
Perfect. Yep. Great, thank you. It looks like we are finished for today. Thank you again, Marysel, for participating. This was a great webinar. Great. Bye.